Welcome everyone to the BCP Council Health and Wellbeing Board meeting. Right, I will just start off, actually, if I can ask our Democratic Services Officer to read out the housekeeping notice.
Thank you, Chair. Please note that this meeting of the Health and Wellbeing Board is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair. For those in the room, please note that if a fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point along Braidley Road under the flyover. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. Thank you.
Right, thanks for that. I will come on just to do apologies and substitute members, and then what I will do is I will just go around the room and ask for people to just sort of introduce themselves, because I think there's a few new faces and not everybody may know everybody else. But yeah, firstly, just apologies for the meeting.
Apologies have been received from Karen Loftus, Matthew Bryant and Lou Bates. And
yeah, any substitute members?
Yes, so Amy Collins is substituting for Karen Loftus and Chris Dominey is subbing for Matthew Bryant.
Right, thank you. Yeah, so on that point, actually, if I could just go around the room just to ask for introductions. So I'm, as Chair of Health and Wellbeing Board, I think you should all hopefully all know me, Councillor David Brown, and I'm the BCP Council Portfolio Holder for Health and Wellbeing. I'll go around this way.
Graham Farron, Chief Executive, BCP Council.
Morning, everybody. Sam Crowe, Director of Public Health.
Morning, Kristen Dominey, Deputy Chief Exec and Chief Operating Officer for Dorset Healthcare.
Good morning, everybody. Cathy Hadley, Corporate Director for Children's Services for Bournemouth, Christchurch. Good morning, everybody.
Morning, everybody. David Freeman, Acting Chief Executive for NHS Dorset.
Morning, Councillor Kieran Wilson, Portfolio Holder for Housing and Regulatory Services. Thanks.
Good morning, Councillor Richard Burton, Portfolio Holder for Children and Young People.
Good morning, I'm Sarah Webb, Head of Statutory Services and Adult Social Care.
Morning, Betty Beltlin, Director of Adult Social Care and BCP Council.
Morning, Gillian Kay, Corporate Director for Wellbeing in BCP Council.
Good morning, Kate Calvert. I'm the Acting Chief Officer for Commissioning at NHS Dorset.
Cecilia Bufton, ICP Board Chair.
Thank you all. Hopefully there's anybody in the room that hasn't met or doesn't know any of the sort of new faces will know now, and also I guess for any public we might have watching as well, just to sort of make it clear who's in the room and who's here. Just agenda item 3 then, election of Vice Chair of the BCP Health and Wellbeing Board. As you know, at the last meeting I was elected Chair, but we didn't have a Vice Chair. So just to seek nominations for the election of Vice Chair. Yeah, Councillor Burton.
Thank you, Chair. I'd like to propose David Freeman.
Thank you. And do I have a seconder for that?
Yes, happy to second.
Thank you. Hopefully that's all right with you, David. So, right, so we've just had one nomination. Any other nominations? No. Okay, so there's no other nominations. So therefore, David, you're Vice Chair of the Health and Wellbeing Board. Often, I know we have Vice Chair sat alongside the Chair. I don't think we need it for this meeting, so that's fine. Okay, agenda item 4, the minutes of the last meeting. So those have been distributed a week or so ago, obviously prior to the meeting. The minutes of the meeting held on 20th July 2023. And members okay to agree those as an accurate record of the meeting, or has anybody got any amendments or comments? No. Okay, everybody's not. So we'll take that as indication that those are an accurate record, and I'll sign a copy of those for the minute book. Right, agenda item 5, declarations of interests. Any members, any declarations of interest, if you can indicate. I've got no indications of any declarations of interest. If during the meeting and discussions about the points on the agenda, anything comes forward that there is an interest, then please indicate, and we'll note that. Okay, so no declarations of interest. Any public issues?
There are no public issues, Chair.
Okay, right, so we can move on to agenda item 7. So we only have two main agenda items for this meeting. So the first one is the Dorset and Bournemouth, Christchurch and Poole Safeguarding Adults Board Annual Report 2022-23. And I know this has gone through various other meetings. I know it's sort of presented to the Health and Social Care Overview and Scrutiny Committee as well. But yeah, I think we've got Sarah and Betty, if you want to sort of just talk us through that.
Yeah, thank you, Chair. So on the assumption that everybody has read the papers, just to give some context, it is a statutory requirement for the Dorset and BCP Council Safeguarding Adults Board to publish their annual report each year, and to bring that report to both health and wellbeing boards. So I'm on the assumption that you've read it. I'm now just going to go to the short presentation. It is a lengthy report, and as Chair has mentioned, it recently went to BCP Council's Health and Adults Overview and Scrutiny, and it did have a lot of scrutiny there, and there will be some further follow-up back to that committee. So I've got a few slides just to talk you through just around the main points of the report, and then I will hand over to my colleague Sarah Webb, who is the statutory head for adult social care here in BCP Council. So next slide, please. So the board has three statutory duties as defined by the Care Act 2014. Local authorities are the lead partner in the Adult Safeguarding Board and have the responsibility to host the Safeguarding Adults Board. So one of the three key statutory duties is to develop and publish a strategic plan which outlines how they will meet their objectives and how members and partner agencies are able and should contribute to that. They publish the annual report detailing what we've done and how effective it's been, and present this annually, as I've just mentioned, to the Health and Wellbeing Board. They commission Safeguarding Adults Review, otherwise known as SARS, when someone has died or experienced significant harm, and it appears that agencies have not worked effectively together. So they're the key three main priorities. Next slide, please. So this slide looks a little bit busy, so I'm just going to take some of the key points from it. So just looking at what the key functions of the board are, it's to work closely with the Dorset Safeguarding Children's Partnership and both community safety partnerships to ensure that young people in transitions from children's services are recognised when safeguarding issues present, and that they're dealt with appropriately, and there's good information sharing between all organisations. It also has a role to make sure that there's a better understanding of the significant impacts of pressures around commissioning within health and social care, and how this may impact on vulnerability and safeguarding. The board also has a role to be involved in people in the communities, working together to ensure we listen to the voices of those that we're working with and the vulnerable individuals within our communities. We work within the new integrated care system, integrated care board, in the context of safeguarding assurances and frameworks around that. We ensure that there is good preventative multi-agency working across all partners, and the safeguarding approaches to support individuals are well managed. There's continued assurance of the application of learning from the safeguarding adult reviews, and it's really important that we do that alongside any domestic homicide reviews and the learning that comes from that, and where there has been learning from any children, safeguarding practice reviews, etc., but the learning is also embedded from those. Enhancing understanding and recognition of domestic abuse and controlling behaviours and how this impacts on individuals. Develop assurance on the delivery of liberty protection safeguardings, which has slightly been delayed through some government changes, but that links primarily to making sure that we have assurance around mental capacity. Preventative safeguarding work will continue to be developed with all partners throughout this coming year, and so forth into the following years. Seek assurance around making safeguarding personal. That's one of the key fundamental principles around the work that we do when protecting vulnerable adults. And improve assurance on delivery of safe practice in private mental health hospitals, and continue to embed and have a think family approach for our residents and to work in partnership to achieve that. I'm just now going to hand over to my colleague Sarah, who's got a few more slides to talk through. Thank you.
Thank you, Bessie. I'd just like to take you through some of the key developments and achievements over the previous period within the Safeguarding Adult Board. So one of the areas that saw significant work was working with the community engagement subgroup, and the subgroup sought to involve a wide range of people to share information around keeping safe. And further work is ongoing with people who have perhaps unheard voices and people who have experienced safeguarding interventions. So hearing from those with lived experience. There's been some work with our colleagues in higher and further education establishments to ensure that students who have also got care and support needs are protected from harm, and that those working in the sector are aware of safeguarding practices and have the connections with the effective links within the safeguarding sector. The board has commenced engagement with the wider registered social housing provider sector and faith groups in the areas. There's also been 2 7-minute learning papers on the subject of understanding homelessness and exercising professional curiosity published during the period. And there's ongoing work with Dorset Healthcare Forum for professionals working with people with complex behaviours, as Betty had mentioned. The independent chair, Sian, delivered some learning at the during Safeguarding Adults Week with keynote speakers. There's been an improved collaboration with and development of an information pack for all board members, which is an extremely useful set of information for new board members particularly. The board has worked alongside other partnership boards, including the Pan Dorset Safeguarding Children's Partnership and Community Safety Partnership, to discuss and share priorities. And there was an annual development event with board members which enabled reflection and sought evidence around assurance about adult safeguarding and further improving our preventative work, including discussion and analysis of data. In relation to seeking assurance, we've had SAR Aziza published with an action plan for all agencies, and the action plan is now near completion. There's been delivery of the board's training strategy, and there's been a review of the business arrangements to ensure effective delivery of the safeguarding strategy. Work has commenced on aligning Dorset Council and BCP Council data with the NHS DICE information, and there's been an update of the policy and protocols for the board. So been engagement by the chair with members, different board members, and ensuring renewed energy and commitment to providing assurance on safeguarding after the pandemic, which is include meeting in person as well as virtually. There's been several activities around assurance of making safeguarding personal, which means seeking to involve and hear the voice of the person that we're seeking to safeguard. And that's included the quality assurance subgroup auditing the application of MSP, resulting in actions for agencies to provide further evidence that MSP is embedded and seeking improvement. And the plan is to continue to monitor and review that over the coming year. Excuse me. There's been agreement delivering MSP will be strengthened further through the training and development strategy that's being delivered, and further focus on MSP at board's development event to ensure greater challenge and assurance about its application. There's just some key bullet point messages from the chair of the Safeguarding Board. Just some information that the chair holds all partners to account for delivering effective safeguarding strategies and services, and for joining it all together across agencies, so working together. Seeks to work across the partnership to continuously improve, and that emphasis this year on ensuring that we share data and intelligence information and understand all the challenges across agencies. And the board has enabled a focus on joining up across the system. And some examples of this is work including with housing partners, being better informed about how the ICS holds healthcare providers to account, and how the police and partners work together to deliver right care, right person. Much of that information that's highlighted in the annual report remains a work in progress through the coming year. And the board is strategically engaged, as mentioned, with other statutory partners, including the Community Safety Partnership and the Pan Dorset Children's Partnership. And the feedback from the chair is that this is effective to ensure non-duplication and most appropriate forms of intervention with statutory reviews. And colleagues, that's the update from us, so just an opportunity for questions.
Chair, if I can just add, I meant to say at the beginning that the chair of the Adult Safeguarding Board is unable to be here today because she's recovering from a planned operation. So she sends her sincere apologies for that.
Thank you, Sarah and Betty, for that presentation. In the absence of Sian, who can't be here today, who'd advise that. Any questions or comments or points that wanted to raise? Sam?
Thanks, Chair. Thank you very much for the presentation. As you were going through, and particularly refreshing the findings and the learning from Sarah Ziza, it sparked a question in my mind that I don't know the answer to, but it might be helpful just to ask it in the board today. A long time ago, there used to be some quite detailed suicide audits that would be carried out, particularly for people who are in contact with mental health services. When public health moved across to the councils, we no longer carry out the audits, mainly because we don't hold that level of personal information. But I just wondered, is that type of audit still done? And I guess I'd ask that as Chris as well. Is that information still readily available? Because I think it touches on a lot of the issues that are being raised by that SAR. Thank you.
Thank you for the question. I personally don't know if that activity is still undertaken. I am happy to feed back to the board to see if they have any involvement with that or if other colleagues have an awareness.
Yeah, thanks for that, Sam. That's a good point. Any other questions or comments at all on the presentation? I know some of us have seen it both at Safeguarding Adults Board and at the Overview and Scrutiny Committee as well. And Graham.
Thanks, Joe. Just one, which is not a question but a comment, and I just think we should record our thanks to the chair and to the board for the work they do. I thought it's a really comprehensive report, gives us real confidence in what's going on and the checks and balances around that. So I just think we should express that and minute it if we can, in terms of our thanks and gratitude for the work they do.
Yeah, thanks for that, Graham. If there's no other comments or questions on that report, well, yeah, I'd like to echo that. Thanks to Sian and the whole Safeguarding Adults Board. I've attended some of the meetings and they can go on for many hours actually, because there's a lot of sort of detailed reports and detailed information that's sort of discussed and not more than discussed actually. You know, it's really sort of thrashed through the sort of making sure that we are sort of fulfilling our responsibilities and doing the best that we can. So, and thank you to Sarah and Betty for presenting that. Okay, so if there's no other comments on that, then it's just down for members of the board to note the report, which informs the board about how the Safeguarding Adults Board has carried out its responsibilities to prevent abuse harm and neglect of adults with care and support needs during 2022-23. So if we're all content to note that report. Thank you. Okay, the next item, agenda item 8, NHS health checks update. I think Sam, as our Director of Public Health, you're going to present on this.
Thanks, Chair. Good morning, everybody. So this paper is, as it says on the tin, it's really to show progress on the local NHS health checks programme. A paper has already gone to the Joint Public Health Board, which gives details about performance under both the councils. But I think it's helpful for both health and wellbeing boards to be cited on how the programme's developing locally, because there are slightly different challenges under each council area. So this is a chance for the Health and Wellbeing Board to have a look at the progress with the relaunch programme, but also hopefully to keep an eye on it and to ask some appropriate questions about how we get an even better programme going forward over the next few years. So although it's called NHS Health Check, it is in fact a programme that's commissioned by councils, by public health teams as part of the public health mandated services. And it offers a risk assessment to people aged 40 to 74 who aren't being treated for heart disease. So these are not people who are currently on primary care disease registers. They're ordinary members of the population. And it's basically trying to find early signs of heart disease, stroke or diabetes. And the sort of key points in this paper are that before the pandemic, I don't think the programme was being delivered as effectively as it could be. And when we looked at the performance back in 2018, you'd have seen a very common pattern, which is that in some of the more affluent areas across BCP Council and Dorset, you'd have seen quite good delivery of the checks. And if you look at the communities where the risk factors are actually highest, and there are more people at risk of these conditions, we didn't have good delivery. Delivery of the programme stopped during the pandemic, and as we went through the recovery process, we took the opportunity to listen to primary care providers and also listen to members of the public to try to redesign the programme. And the main aim of doing that was try to get better coverage in the areas where primary care wasn't stepping forward to deliver. We listened to the comments coming back from surgeries. A lot of them understandably said they were under pressure. And the focus in those areas is very much on provision of access to primary care. This was not a programme that they felt that they wanted to step forward and deliver at the time. So with that in mind, we agreed to develop a new service, and we've begun to use Live Well Dorset, which is our integrated health behaviour change provider, to start offering targeted checks in communities where there isn't primary care coverage currently. So the paper presents the first 2 quarters data, and the summary, you'll see it shows improvement overall in the number of invitations and checks being delivered, but there are still some areas where we don't have great delivery. North Bournemouth, Central Bournemouth and Poole Bay. And so those areas are very much the priority focus for Live Well Dorset. And then I'll just note a couple of ongoing challenges for the board, perhaps before we break for discussion. One is this ongoing challenge around uptake. So it's always a fine balance between pumping out invitations and then having a low number of checks actually delivered. We're challenging providers to think differently about how they invite people to the programme. If you just send out an invitation and you don't get much response, then I think that tells you something about the need to change what you're doing. With Live Well Dorset, they offer the chance for people to book directly with that service, but they also look to work alongside community organisations to try to publicise when they get an area, so that residents know that they can get a check on a particular date. I'd like them to think more about how they would do high volumes of checks. So at the moment, they might be doing 10 to 15 in a single community event. One of the conversations we're having in the new year is how they could perhaps partner with organisations and be in a locality for 1 or 2 weeks so that residents know that they can get a check on a consistent basis, and perhaps we can up the volume a bit. And then just finally to note that there's an ongoing challenge around uptake in some key groups who also have a high risk of cardiovascular disease. So if you look at the number of people from Black ethnicity who come forward for checks, it hasn't changed very much over the past 2 or 3 years. So again, we're starting to think about how we would work some of the community organisations that have good reach into those communities to try to publicise the checks more and understand what are the barriers for people coming forward. I think the final point I'd just like to close on is that prevention of cardiovascular disease, heart disease, stroke and diabetes is also a priority for integrated care systems driven by a national focus, particularly around finding more people with high blood pressure. So perhaps we could think about how we work better together to increase the awareness of these checks, but also some of the other opportunities where people can have their blood pressure checked and have a bit more of a consistent offer to the population. And above all, I think it's really key that people in communities are involved in understanding how important these checks are. It's not just about medical professionals reinforcing their importance. I think if you can get that message out to the public, then that also drives interest and we'll have a healthier programme as a result. So it's for noting today, Chair, and happy to kind of break there and take questions. Programme.
Yeah, thanks for that, Sam. Yeah, any questions or comments or queries, Councillor Wilson?
Chair, thank you. Yeah, it was just paragraph 4.2. The data in the written part of the paragraph seems slightly different to the table. And I was just wondering, is there any reason for that? And the second part of that question is just around the invites sent. How are invites sent out in order for people to get these checks? Because obviously we want to increase the uptake. So how are we reaching them?
Thanks very much. Very eagle-eyed. Yeah, I hadn't spotted that actually there's a slight difference there, isn't there? So 4.2, the narrative says 2,647 checks delivered. And then we've got 2,492 in the table. So I'm not sure why the two figures don't match, but I'll take that away and clarify that if that's helpful. I think the question about invitations is a really good one though. So I think a lot of the practices that are involved in sending out invitations use their own registers to do so, and it's generally a letter. I think some practices text people as well. But one of the challenges of the programme is that when it was first established, there was no national call and recall system set up for it. So if you think about some of the other national screening programmes like cancer screening, breast cancer screening and cervical screening, all have single national registers, and that call and recall process is managed on behalf of practices at scale. In this instance, you've got primary care providers doing slightly different things depending on their understanding of their own processes. And so it's usually a letter, but I think we would be interested in understanding more about what people do when they get the letter and why they don't respond to it. So if there are different ways that we can drive invitations, we're more than happy to think about some innovation. Increasingly, in terms of the checks that Liverpool Dorset offer, we use social media. That's quite a good way of engaging. But if you're not on social media, then you wouldn't know that the checks are happening. So we do have to think about a range of ways of inviting people. One of the questions I have, which is as we move into becoming an integrated care system, whether we could use something like the Dorset Insight and Intelligence Service, which is the population health platform, to do something a bit more consistent and at scale around invitations. That could be quite an interesting development in the future. But at the moment, it's down to individual providers to send out the letters.
Thanks, Chair. Sam, thanks for presenting this and also setting out some of the ideas for the future. I know when this was discussed at Joint Public Health Board, obviously we had the BCP Council figures and the Dorset County Dorset Council figures alongside each other, and there was a slightly higher level of take up in Dorset Council, although not significantly so. And I wonder whether there are any other parts of the country who've managed to really shift the dial on this, who perhaps have a similar demographic to BCP Council area, and whether there are any lessons we could take from partnering with another area and just sharing their learning and experience, because this is not an uncommon challenge, is there, in getting that take up, especially from communities who could most benefit.
Yeah, thanks, Gillian. I think that's a really good point, and it's something that I'll ask the team to be doing over the next year. It is a programme that I think the Southwest performance hasn't been good. So if you look at other councils across the Southwest, I was quite keen that we turn this around, because at one point Dorset and BCP Council had among the lowest checks being carried out in the country. That's no longer the case. I think BCP Council was the most improved area in the southwest in the latest regional report. But it is a challenge to sort of keep going with this programme, and I think it's ripe for understanding how we do it differently and not just repeating things that we've always done. So we'll definitely be asking for evidence from around the country about where people have done innovative things. I know that in the Midlands, they're very keen on having large volume health check events connected with things like Premier League match days. That's something that I think we should explore. Previously, AFC Bournemouth have stressed that match days are all about football, but we are starting to pick up and have conversations with their community sports trust about how we perhaps use the football brand to do more around health improvement, and that's a conversation we'd very much like to have.
Thanks for that. I'll come to David next. Yeah.
Thank you. Sam, I was just thinking, from what you were saying there about the football club, given the events at Bournemouth over the weekend, that's really interesting, isn't it? I know you said capitalise, and I don't quite mean that, but I mean there's something about it being, you know, at the front of people's minds. So worth following up. And that wasn't my question. Just to sort of, I was two parts of what I wanted to just check in on. One is a kind of curiosity about. So I've had the health check invitation letter, but I'm not in this catchment, so don't worry. I'm not in your figures, but I haven't taken it up because I've been to the doctors for other means and I've had the blood pressure check and all the rest of it. So if it came, I would ignore it. And I was kind of wondering, you know, is it that we've got enough activity going on which people are getting checks on? It's more a rhetorical question, really. I guess there isn't an answer to that. But there is something else about. I went to a public engagement event in Blandford a couple of weeks ago, and I had my blood pressure taken there just as a check, and that was done by Live Well Dorset. So presumably you're capturing those figures as well if you're running events like that.
So that's a really good point. Because it's called an NHS health check, there are quite tight definitions about what constitutes an NHS health check. And I think this is sometimes where we really confuse the public, if I'm being honest, because we're over here talking about an NHS health check that's actually delivered by council public health teams. So that's confusing in the first instance because it's still got that NHS branding against it. And then there's also a number of other checks that are carried out, such as the physical health checks for people on mental health registers, and there's also health checks for people on the learning disability register. So we talk a lot about health checks, perhaps without being clear with the public. If you look at the international evidence of areas that have done really, really well on heart disease over a long period of time, I always go back to places like North Korea that had a sort of classic multi-pronged approach. And although they had something quite similar to the health check programme, which was run by primary care, it was actually the community level awareness raising that I think drove people towards a better understanding of why blood pressure and cholesterol levels and diet and exercise are important. So each of these checks has a place. There's something about how we communicate more clearly with the public globally about some of these risk factors, and more importantly, where they can go to get some help or have an assessment that will provide that information in a really timely way. But in terms of whether Live Well Dorset would capture that blood pressure as an NHS health check, it wouldn't count because presumably they didn't do a finger prick blood. So does that make sense?
David. So part two, thank you, Sam. It's really super helpful. It's a bit more chunky. So I just had curiosity around whether the number of health checks. So my first thought was, are we capturing the worried well and they're coming forward? But actually, it looks like a large proportion of the people who do come forward, 5% of people you are finding risk factors with, which is really encouraging. But the graph above that, so I just wanted to sort of check my understanding. Is it, you said you've got a proportion in the target group and a proportion not. Is it that we are capturing the people who we would like to see, who we suspect might have risk factors that we want to check out? Am I reading that right? So we're we're not just getting the worried well coming forwards and just having loads of health checks where nothing else is coming of it.
Yeah, it's a really good question. There's two things going on. So the 65% refers to guidance that we've given to health check providers to say, when you're doing your searches, to invite people preferentially for a check, can you use some criteria to make sure that they're targeted to groups where risk factors are more likely? So that's what that 65% refers to. At the end of the process, if you're asking about the proportion of people that meet that threshold that then get entered onto the primary care register and managed, it's around about 3 to 4%. That's pretty standard across the board. But in some communities where we've done high volume events, that's risen as high as 10 to 15%. So I think it depends on the type of the event, but generally it's about 3 to 4% actually go on to the primary care registers. Does that make sense? So 65% is the closer targeting.
Thanks for those responses. And Betty, you indicated.
Thanks, and thank you, Sam. I just wonder if we're utilising all of the opportunities that we have already at our disposal to really promote this, because these health checks are so important. You know, we've kind of listened to the 65% and also the worried well, and just reassuring them with some of these, you know, what's involved with the checks. So I guess my point is, appreciate where it's being led from. Are we taking full advantage of those people that we already know, that are already known to us? Because collectively within our health and social care system here in BCP, the BCP council area, we already know a lot of our population. So I'm thinking, Sam, places like the council's contact centre, customer care, is there something that we could be saying to them when you're talking to our residents? Can you just mention, are they in this age gap, 40 to 60, what was it, 40 to 74 or 72? Are you in this age gap? If you are, have you had your health check? If you haven't, could you contact your GP? Or, you know, whatever way we do it, I don't know. You know, there's ways to do this, but also within adult care and possibly within our children's and housing and everywhere, we have lots of people already known to us that have vulnerabilities and that have long-term conditions, and it may be something that we can really promote there. But I definitely think there's some scope around, just let's add that into our conversation. You know, we have thousands of people, thousands and thousands of people that contact us throughout the month, and it's really important that we're targeting them in the easiest possible way. So really happy to help you and assist you in any of those ways. I think there are possibly quick wins. I don't know if you're doing that or not. We're not doing it for you in adult care, I know that. And I'd be surprised if we're doing it within customer services. So let's have a conversation if that is something that you think is viable. Happy to assist. Thanks, Sam. Thank you, Chair.
Yeah, thanks, Betty. I think it would be really helpful to have that conversation, and it's something that we've thought about for a while. Better integration of services like Live Well Dorset through customer contact centres. So I think that's a really good idea. Probably need to be careful of the messages. Phone your GP might not be welcomed at the moment, but there is something about making sure we've got you know, the right channel that can take inquiries from the public if they're prompted on that call. That's a really good idea. Thank you.
Thanks for that. Any other questions or comments on the health checks report? Nobody's indicating. No, I mean, no, recently went through the Joint Public Health Board as well, and I think for me that probably the most interesting bit was the differences between the different sort of primary care areas and the different networks, wasn't it? That obviously showed they're all sending out similar letters. You know, there's a very different sort of response rate in different areas. So it's either the targeting or the messages that are going out, or I don't, whether they follow it up or whether they use text messaging. So there's definitely, I think, lessons to be learned from the sort of better performing areas for those areas that we sort of need to sort of boost take up, so that residents right across the whole conurbation can make sure they're sort of getting the sort of equity of service really, and equal opportunities for this. And I think, yeah, it would be nice to see the sort of the response rate increase, because I know obviously Dorset was that bit higher. So yeah, I think we do need to sort of learn those lessons from the areas where it sort of seems to be performing better. And thank you, Betty, for your comments as well about just routes that we've got as a council that can communicate this sort of the sort of opportunity for people to expand that. So okay, if there's no other comments or questions on this, we're asked to, as members are asked to note the programme changes and the mobilisation of the new service, which is detailed in the report, and note the activity increases among those communities in most need, and then consider the performance of phase 1, which I think we've done in our sort of questions and points. So I think we can just note in the minutes that we've noted that, we've discussed it, and yeah, I think there'll be conversations need to sort of go forward to sort of make sure we make the most of the opportunity to actually sort of improve responses. Okay, agenda item 9 is the forward plan. I know we've got a sort of workshop development session coming up later this morning, so consideration of this sort of forward plan will be part of that. Any other comments regarding the forward plan for the no, anybody? Okay, I think we'll pick that up in our sort of workshop program later this morning. So, okay, thank you everyone for attending. Look forward to our workshop later this morning where we can sort of work on sort of how to sort of improve and develop what we're doing as a health and wellbeing board. But thank you for attending this morning. I know it's sort of really just a couple of papers to note, but I think there's been some useful questions and points raised there. So if that's everything, then I think we will close the meeting. Thank you.